Hi, one of the most important visits in our clinic is your second visit. We call it the report of findings because that's what we do. On your first visit, we take a history, a physical examination, and you may or may not have x-rays. Then we work out a diagnosis. What's wrong? What's the nature of your problem? What's causing your pain? And we report back to you our findings. So the key points in a report of findings visit is to lay out a roadmap for your program of care. Someone with a simple problem may require a few visits. Someone who has a chronic problem may need an initial intensive care program that could last 6 weeks. There's a schedule of visits or appointments over that 6-week period. Key points to remember in the report of findings. Number one is healing takes time. It's the law of the farm. If it takes 6 months to get a wheat crop, under optimal conditions, it takes 6 months to get a wheat crop. A billionaire cannot buy a wheat crop in 1 month. Nature does what nature does. Number two, your appointment schedule is really important. If you're supposed to be treated 2 or 3 times a week and you have to reschedule, make sure you get those visits in that week. Because it's like fighting a fire and taking a coffee break every 2 hours. You come back to a full fire. You have to stay with it and you have to work with it. The other thing is, some people get reactions. It's like going to the gym for the first time in 6 months. You get sore, and that's perfectly normal. Up to 50% of people can have a reaction to treatment. Pain in the area where their complaint is. It's not severe, it's not bad, it's manageable, and we can teach you what to do to manage it. If you ever have trouble where you're concerned with the reaction, give us a call. We'll get you in on the day, and we have strategies to deal with that. The other thing is, pain is the tip of the iceberg. So an iceberg has 10% sticking out of the water that you can see and 90% you can't see. Pain being the tip of the iceberg is we can get rid of pain quite quickly, but 90% of your problem is what you don't see, the underlying weakness, the instability, what led you to have the problem in the first place, or what resulted from your acute injury perhaps. We deal with that underlying structural problem when the pain goes with rehabilitative exercises, strengthening, stretching, increasing aerobic fitness. And the last thing to consider is maintenance care. Like a dentist, you go every 6 months. Why? Because you want to prevent big problems coming from very, very small problems. If you detect things early, they're easy to manage and quite easy to fix. So a lot of our patients find that if they get treated once a month, once every 3 months, once every 6 months, before they have problems, they feel better and they don't have those recurrences of acute pain that they had in the past. So an ounce of prevention. So your report of findings is how we communicate with you. If you haven't had a report of findings yet, or you've been a long-standing patient and you want one, ask us and we'll do one. To make sure you get our weekly videos via email, go to the subscribe page or use the link in the description. Another great way to get our video updates is to follow us on social media with the links below. And thank you for watching.